Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, we're going to have a great show today. We're going to talk about senior care, the quality of senior care. But first, what about diabetes and prediabetes and the opioid expansion? We're going to chat about that with someone from the Pennsylvania Medical Association.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, I guess I should have said Pennsylvania Medical Society, but not association. But a society association, it's yeah.
They know what we mean.
What's important is what you all do. Well, joining me is Dr. Danae Powers. She's the president of the Pennsylvania Medical Society. The host will get that right. Look, I'm glad you're on today because we're talking about one of the subjects, healthcare subjects, that I think is tremendously important. It's diabetes and prediabetes. If I understand the statistics, 30 million Americans have prediabetes, which ultimately can lead to diabetes, which can lead to some very serious health effects. I mean, even life-threatening health effects. Oh, yeah. Have I said anything that's incorrect?
Absolutely not. You could go farther. Diabetes is a very serious illness, and it's causing a lot of health problems for Americans.
Yeah. Well, let's start first of all with what are the signs that once you get these signs, you should obviously consult a physician?
Well, that's one of the problems with diabetes. You can be pre-diabetic and not have signs. If you wait for the signs of diabetes, you have what we call the end organ effects. You can have nerve damage, cardiac disease, trouble with your eyes, renal damage. So the goal is to intervene and diagnose before people are down that pathway, often right. Irreversibly down that pathway. Right.
That's important. The other thing, I mean, you've got the signs, but then you have these two different types that I don't know that we're all as familiar with as we should be, type 1 and type 2.
Right.
Explain.
Right. Well, so diabetes is a disease of sugar. I mean, the lay term is sugar. Mm-hmm. We have too much. Glucose is a food source. It's an energy source for our tissues. Our body takes our food, converts it to glucose, and then our tissues use it. If the glucose gets too high, you're diabetic. There's two reasons why it may get too high. One is the pancreas, which makes insulin, has failed, and you're not producing insulin. That's called type 1. Okay. And those are the people that can get very seriously ill. They need to take daily injections. We need to replace the insulin. Type 2 diabetes is a type of diabetes where you may or may not be producing enough insulin, but for some reason the body isn't responding properly to it, right. Or you may not be producing the right amount. So it's not as severe a disease, however, long-term it has devastating consequences, and it needs to be addressed.
Now, is type 1, do you inherit, is it a genetic predisposition? Go ahead.
There's a possibility. It's not purely genetic. There are people who can get it outside of a genetic pathway, but there seems to be a predisposition that if others in your family have it, you may be more susceptible. Okay. It's felt like it could be a viral illness, something that attacks the pancreas.
All right. Now, generally speaking, when you've got pre-diabetes, I mean, there are things that you can obviously do to prevent it from becoming, from you becoming diabetic. A diet, exercise, there's a whole list of things. Right. And when I've chatted with my physician, I mean, he has gone into detail about things that you should and shouldn't do. Just lay out a couple of the things that are...
So prediabetes is you have a blood test and it shows that your glucose is elevated. So it's a sign that you're heading in that direction. At that point, you start addressing lifestyle issues. Right. Diet. You start trying to eat healthier. Exercise. Try to get recommended amounts of exercise. Obesity. If you're overweight and you lose weight, the risk of progressing to diabetes goes down. So it's lifestyle changes that people can make that can impact whether or not prediabetes moves on to diabetes. Without changing lifestyle, up to a third of people with prediabetes will progress to type 2.
And when you think about it, these are things that you're going to have to adjust in the normal course of your living. But they're not impossible to do.
No, and the Medical Society has actually put together a program called the Diabetes Prevention Program. We have a website where you can actually look up where these different sites are, but it's a program designed for physicians to help screen, test, and refer patients, and for patients to get information on what they can do to minimize the risks of progressing to diabetes.
Now, more and more, I think the physicians that I know are acutely aware of this and talking more and more to patients about it. I mean, I think we're probably in a situation right now where that's more common than not. And you know, when somebody comes in and they're a bit overweight, and a physician starts to talk to a patient about lifestyle, they immediately pick that up. And you know, the numbers of people that are pre-diabetic are absolutely staggering.
Oh, a third of Pennsylvanians are probably pre-diabetic,
gosh.
And of that, up to a third will progress. So it is a huge health burden, both for an individual and for us as a state. And yes, physicians are very focused on trying to educate patients and screen patients and push out into the community information about things you can do to protect yourself.
All right, well, we're going to take a break. When we come back, we're going to talk about opioid use disorder, what to do about it. It is, you want to talk about another problem that has escalated in recent decades, opioid use disorder. We'll be back with Dr. Powers, finding after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Well, Dr. Danae Powers joins me. She's the president of the Pennsylvania Medical Society. We're chatting about a number of important healthcare issues, diabetes and prediabetes we covered in the last segment. Now we're going to talk about opioids. Doctor, I want to tell you, if there is something that has gotten more attention in terms of healthcare, you can't find it. I mean, it's opioids, opioids, opioids. The other aspect of it that I find very compelling and important is that Democrats and Republicans, they don't agree on much today, but they do agree on the seriousness of this, and national as well as state funding has been made available to combat it. So before we get into talking about the treatment, you know, prior authorization, removing that, and you can explain that for the folks in our audience, what's your sense about the growth of it, the expansion of it, the horrific, I'll put it this way, expansion of it? In your practice, I'm sure you...
It's tragic. It is a tragedy. It's facing us on an individual level in communities. It's facing us as a state. It's facing us as a nation, and the lives that are being lost and the suffering experienced by families. It's unimaginable, and we need to fix it.
Yeah. Well, I mean, even when I go to my own physician, not to get personal, but I notice on a screen they have some statements in the monitors in the offices about they're well aware of opioids, and they're, you know, in their prescriptions they're now being much more careful than they used to be, and hopefully pharmaceutical companies are equally aware of the problem.
It's a multifactorial driver for why people end up having opioid disuse or opioid use disorder.
Yeah.
But clearly part of it comes from prescription drugs and interactions with the healthcare community. And the Medical Society has actually been very active in drawing up voluntary prescription guidelines, working with Secretary of Health, Dr. Levine, to push out naloxone as standing orders. So we're doing our part from our end to try to impact the crisis.
All right, let's first of all talk about something that was called pre-authorization for treatment of it.
Right.
Now, first of all, what does pre-authorization mean?
Well, generally, it means that prior to a patient receiving care, an insurance company has to weigh in and say, we will allow it to happen, we will pay for it.
Okay.
So that's kind of the general term. In the particular instance with the opioid crisis, there is a type of treatment called medication-assisted therapy, whereby a patient who has an addiction to opioids can be given medications that help decrease the craving. And it can be very effective as part of the treatment plan. And we have worked Governor Wolf has worked with the Medical Society and the major insurers in the state of Pennsylvania have agreed to remove prior authorization requirements for patients who need medication-assisted therapy for opioid use disorder.
So that means you go in, if you have the problem, you can be treated by a physician.
Absolutely.
They can work with you, and you don't have to go through
the insurance company
what could be a lengthy process to get authorized.
Right, and we're the first state in the nation that has done this. 7 of the major insurers have agreed to go with this. Governor Wolf's office really worked with them to make this available for the patients in Pennsylvania, and we're very excited about what it means in terms of saving lives.
Now, when did this occur? I should know this.
It was passed in September.
Okay.
In February, it rolled out for Medicaid patients also. So we're very excited about what this could mean to address this tragedy that we're all dealing with.
So the expectation is, long term, this is going to allow people to get treatment quicker and hopefully before when you're addicted, I guess you're addicted, but to deal with it at an earlier stage so it doesn't even more wreck people's lives. Time
is dangerous when you're dealing with addiction. You want to fix something sooner rather than later.
Well, look, I can't thank you enough for coming in. This is a hugely important update. All right, coming up, the challenges facing senior citizens. We'll get to that in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is brought to you by the Association of Pennsylvania State College and University Faculties, representing the faculty and coaches who are devoted to providing quality public higher education for Pennsylvania's college students.
What about the quality of care for senior citizens? Joining me to talk about that is Russ McDaid. He's the president and CEO of the Pennsylvania Healthcare Association. Well, Russ, I think you know as much about this as anybody. More than 2 million of us in Pennsylvania are over 65, and it's the largest in percentage terms growth in any demographic group. I mean, you're talking about huge proportions of people in our state who become 65 or older, and that poses serious challenges for their health care. Do I got that about right?
Yeah, Terry, we're facing unprecedented challenges, not just from that 65-plus group, but the 85-plus age group.
Great point.
Here in Pennsylvania, we're number 3 in the country in our percentage of residents that are older than 85. And that's really, with the work that we do at the Pennsylvania Healthcare Association, the population that we really are most focused on. And today, as people are staying healthy longer and aging better, we don't typically see individuals until they're into their 80s who come to us for 24/7 care solutions.
Yeah, I mean, the other aspect of this is obviously as we get older, we need more additional care. And then you have the problems of, lots of folks, they have their parents and they have to have their own families and their own work, and they have to be concerned about folks as they age and whether they can, take care of themselves. And so, in general terms, what's the state of long-term care in PA?
Well, there's a tremendous need for round-the-clock care, and there's no way to get out from under that. When people look at their long-term care needs, there's a common misconception out there that it's less costly to care for somebody in their own home than outside their home in a 24/7 facility. When you need round-the-clock 24/7 skilled cares, the facility has always been and continues to be the most cost-effective place to get that care on a 24/7 basis. That's the challenge that our state government has. Yeah. The state Medicaid program pays for 70% of that care, and they are struggling to keep up with costs. In fact, right now, Our Medicaid-funded providers have reimbursement rates that lag their cost of providing care by almost $50 per person per
Wow.
day. I mean, that can be over $1 million a year for a 100-bed nursing facility.
Yeah, I mean, what's fascinating is that people will obviously try to do it themselves, and sometimes they'll have a professional come in, but at some point that's just not possible. I mean, and this, I've been through this. I mean, lots of folks have been through this. I mean, that's a hugely important decision that a lot of folks just simply aren't prepared to make. And learning about that is one of the more important things about how you deal with aging.
Well, that's right. And the other piece is we probably don't have enough caregivers to meet that need.
Oh, great point.
You know, I mean, we've got, you know, if we're caring for one caregiver per person in 2 million Pennsylvania households, those numbers don't add up. We already have a caregiver shortage. It's already challenging to get them to stay with us, and there just aren't going to be enough skilled caregivers to go around.
Yeah. The other aspect of this is that when you reach that decision where you have to, you know, a decision has to be made about where to go, that's a tough decision. How does a family even begin to think about doing that, selecting a facility?
Yeah, I mean, first of all, there are no right answers. Every family situation is different.
Yeah.
But you've got to be honest with yourself and honest with your loved one. The toughest conversation, is always getting over the hurdle of the need, getting mom or dad or grandmom or grandpop, to kind of understand, you know what, you just aren't safe anymore where you are. We love you too much to have you at risk.
Yeah.
We're worrying, you're worried. Let's see how we can find a solution for this.
I'll tell you, we're going to run to a break and we come back. I want to talk more about this. I mean, how do you start this conversation? How do you have the conversation? What do you do about it? And here we are in a holiday season where, maybe that's a good time to do it when, first of all, you spend more time, hopefully, with your loved ones anyway. We're going to run to a break. When we come back, we'll do that and more.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, the future of long-term care.
Russ McDaid from the Pennsylvania Healthcare Association is my guest. We're chatting about the big questions about aging, quality of care, how you deal with members of your loved ones in your family when you have to make some pretty big decisions. Russ is one of the great experts in this state who deals with this on a daily basis. All right, so here's the point. You got to sit down and have these conversations, and as we say in Lancaster County, that ain't easy, is it?
Never easy, and it's never the right time. The holidays are one of the best times, though. We know that we often have all the siblings home at the same time with mom and dad, where we can start to have the conversations. Have you thought about how you're paying for it? And it goes from how are you going to pay for it, and maybe a long-term care insurance conversation, into then, when the time comes, what would you need? What would you want? And what type of community would you be choosing? I mean, we have options across the board, from independent living that looks a lot like an apartment complex that your college student might live in, except it's primarily seniors living independently with a community center and a place to congregate and some social and dining options, all the way through skilled nursing, which is essentially a hospital stay for somebody on a longer term basis.
Yeah, but now when we think about this, and one of the things that we've talked about over the years is it's nice to have the conversation, and I want to talk a little bit more about how you get it started and should we be doing it over the holidays. But in reality, isn't this something that folks ought to begin to think about decades before they reach the senior years?
Well, of course, but none of us
probably
ever
a dumb question.
plans. Well, we plan for everything. The two places we don't plan because they're the least comfortable, believe it or not, are our retirement and our long-term care needs.
Yeah.
A lot of people just kind of let the retirement
point.
roll and then look at it at 60 and say, oops, I
yeah.
got to spend a lot longer working than I thought.
Yeah.
Long-term care can be the same way.
Yeah.
And it's really, it's researching those options, getting out when you're younger to visit communities. I mean, I said that we have a workforce challenge. Our folks that we represent would love to have members of the community in, either as volunteers or as friends to their residents, and that gives you a good first-hand look at what's going on inside a center.
Yeah, then you get inside, you learn what the do's and the don'ts, you learn what you should be doing all along. Yeah, I think you're right about that. We all tend to put things off, particularly when you're talking about retirement and when you're talking about something as important as that. So how do you get this conversation started?
Well, you got to just take it head on, Terry. You got to take it head on. You got to say, Mom, we're getting to that time.
Yeah.
We don't want this to be. It's never going to go well for you. I want you to be where you're comfortable.
Yeah.
And the only way for that to happen is us to start talking about it now. And too many families find themselves on the wrong end of a fall, where there's a hospitalization, and that's when mom or dad has to go to the facility. They've done no planning. They're stuck on that Thursday or Friday afternoon. You're getting discharged from the hospital. You can't come home yet. Where are you going to go? And they're a deer in the headlights. And advanced planning and conversation can take that edge off of that very difficult time.
So you think that the holidays are a good time?
I think they're always a good time.
Because we're upbeat, we're happy, we're excited.
There might be some eggnog on the table. Right. We're all together. And even if, it's not going to go the way you want it to. You're probably going to get pushed back if you're a son or a daughter. But then tomorrow afternoon, and my own experience, it'll just come out in natural conversation. I've given that some more thought, and I might like to look at this kind of facility or that kind of facility.
No, I get it. I mean, I think that's a tough conversation to have, and you might have to have it over a period of time. And I do think my mother was the same way. I mean, they're really reluctant. Well, sometimes they're reluctant to do this. Others are happy, and you just don't know what the reaction will be. Maybe you do if you know your parents. Right?
I don't think you can ever predict it. The one thing I can say for certain, we find very few people who, once they've made the tough decision and the emotion is gone, if they were isolated in their home, particularly widows or widowers who hadn't made that decision, they have more socialization. They will start to see their health status improve because of that socialization. It is not the end run. In fact, many times it's a new beginning for folks. And so I would encourage them not to look at it as the end of the road, but a potential new beginning for a new chapter sometimes.
Boy, hold on, I'm interrupting you here. You've made a point that needs to be re-emphasized. It's a new period in someone's life. Everyone that I know and I don't know a huge number of people, but guess what? Once they get in, they make friends. You couldn't get them out once they get into a facility.
That's right. In fact, we hear from people all the time. Family shows up. I had a lunch date with Grandma. She was too busy to join me.
Great point. All right, we'll see you next week for another edition of Pennsylvania Newsmakers. And as always, stay well.